Good morning, everyone. Today I'm going to discuss a very important topic in maternal health care, namely physiologic birthing and demedicalization of birth. Childbirth is one of the most natural events in human life. Yet, over time, it has become increasingly medicalized. While medical interventions can save lives, when the complication arises, many women can safely give birth without any medical interventions or with minimal intervention. In this presentation, we will explore what is physiologic birth means, why the demedicalization is important, its benefits, its challenges, the strategies to support natural healthcare professional, strategies to support natural birth. So, by understanding these concepts, healthcare professionals can give more woman centered and evidence based maternity care. Before we begin, let us look at the objectives of this presentation. By the end of this session, you will be able to explain the concept of physiologic birthing and demedicalization of birth. You'll be able to define both terms clearly, discuss their benefits, understand how the woman can prepare for these approaches, and identify the key aspects and challenges and learn the strategies that promote physiological birth. Think of today's presentation as a journey from understanding birth as medical event to understanding birth as a natural physiological process that usually works best when supported rather than controlled. Let us move on to the introduction. Imagine planting a seed in fertile soil. If the environment is right, the seed naturally grows into a healthy plant without much interference. Childbirth is very similar. The female body is naturally designed for pregnancy, labor, and birth. Physiologic birth allows this natural process to occur with minimal medical intervention. It respects the body's amazing ability to give birth. During physiologic birth, labor progresses through natural hormonal, physical, and emotional mechanisms. Medical procedures are used only when truly necessary. So, midwifery organizations around the world describe the physiologic birth as a process powered by innate abilities of both mother and baby. In simple words, nature takes the lead, while the healthcare providers offer only support and safety. Definition of physiologic birthing. Physiologic birthing refers to the labor and childbirth that occur naturally with minimal medical intervention. It is guided by the body's own hormones and physical mechanisms. A good analogy to explain this is you can consider a woman learning to ride a bicycle. Initially, support may be needed, but the actual balancing happens naturally once the rider gains confidence. Okay, similarly, in physiologic birth, healthcare providers support the woman while allowing her body to perform its natural function. Normal physiologic childbirth begins spontaneously, progresses naturally, results in vaginal birth, allowing natural separation of the placenta and supports immediate skin to skin contact and early breastfeeding. These processes work together to promote health of both the mother and the baby. According to World Health Organization, physiologic birth occurs without unnecessary interference and follows the body's normal biological function. Definition of demedicalization of birth. Demedicalization of birth means reducing unnecessary medical interventions and returning childbirth to a more natural woman centered process. This does not mean rejecting medical care. Instead, it means using interventions only when they are medically necessary. Think of it like using an umbrella. Okay, so we use it only when it rains, right? But we do not carry it open on a sunny day. Similarly, interventions should be used when complications arise and it should not be used as a routine practice for every birth. Demedicalization encourages informed choice, respects women's preferences, and promotes evidence based care. Practices such as routine episiotomy, unnecessary labor induction, and continuous fetal monitoring may be reduced when they are not needed, allowing labor to unfold naturally. Benefits of physiologic birth. Physiologic birth offers many advantages for both mother and the baby. Mother often experience less pain after birth. They recover more quickly and they will feel a great sense of achievement and confidence. Many women describe the natural birth as an empowering experience because they actively participate in the birth process. For babies, the physiologic birth supports better adaptation to life outside the womb. Immediately skin to skin contacts can be achieved, and that helps the baby to feel secure and strengthened, and it increases the emotional bond between mother and child. Breastfeeding often begins more easily, and babies will be looking calmer and they will be more settled. Researchers also suggest that natural birth may support healthy gut bacteria and immune development. Overall, physiologic birth promotes physical, emotional, and psychological well being for both mother and the baby. Additional benefits extend beyond the immediate birth experience. Mothers who have a physiologic birth often have less genital tract trauma and fewer stitches. Some research even suggests that natural birth stimulates the production of proteins that may support newborns' brain development. Demedicalization also reduces the risk of complications associated with unnecessary procedures like infections or excessive bleeding. Another important benefit is empowerment. When women are actively involved in decisions regarding the childbirth experience, they feel respected and valued. This often leads to greater satisfaction with the birth experience and more positive memories of childbirth. The benefits of demedicalization of birth, as we have already discussed, they are reducing the risk of complications arising due to infection and bleeding, and increased sense of empowerment for the mother and positive birth experience. Preparing for demedicalized birth or the physiologic birth. Okay. Preparing for demedicalized birth begins with knowledge. Women should educate themselves uh, about normal labor and discuss their preferences with the healthcare providers. Birth plans can include preferences regarding mobility during labor, pain relief methods, and the use of interventions. Several practices support demedicalization, such as avoiding routine episiotomies, reducing continuous fetal monitoring in low risk pregnancies, and avoiding unnecessary labor inductions. And natural pain relief methods and techniques like breathing exercises can be taught for the woman, and massage and relaxation and movement and immersion can help the woman to cope with labor effectively. Continuous support from doulas and family members can also increase confidence and reduce the need for interventions. Examples of demedicalization practices. First is avoiding routine episiotomies. So they are the surgical incisions that is performed in the perineum to enlarge the vaginal opening to aid the head to come out during birth. They often they are often unnecessary and can lead to increased pain, bleeding, and infection. And reducing the continuous fetal monitoring. Okay, so because that can lead to infection and resisting unnecessary labor induction or augmentation, because there is a risk there, it can be used more. Judicious administration of oxytocin is always indicated, because if it is used more it can lead to uterine rupture. So unnecessary induction can be resisted. And promoting natural pain relief methods like breathing exercise, massage, and movement to cope during the pain during the labor, and encouraging water birth, encouraging natural birth, and involving doulas to provide continuous physical and emotional support during labor and birth. We'll move on to the key aspects of demedicalization. Key aspects of demedicalization. The key principle of demedicalization is recognizing childbirth as a normal physiologic event rather than a medical condition. Care should be individualized because every woman and every birth experience is unique. Unnecessary interventions should be minimized while supportive care is increased. Midwives, doulas, partners, and nurses all play important roles in providing emotional and physical support. Decisions should be based on current scientific evidence rather than routine practice. So ultimately, demedicalization aims to balance the safety with the respect for the body's natural ability to give birth. While demedicalization offers many benefits, it is not without challenges. One of the biggest challenges is resistance from some healthcare professionals who are accustomed to natural medical approaches, or accustomed to traditional medical approaches. Change can be difficult, especially when certain practices have been followed for many years. Another challenge is concern about safety. Some women and their family may worry that reducing interventions could increase risks during labor. However, it is important to understand that demedicalization does not mean avoiding medical care when it is needed. Instead, it means using interventions wisely and only when medically indicated. So, education is therefore essential, and women, families, nurses, and doctors need accurate information about benefits and limitations of both natural and medical approaches. Healthcare facilities also need policies that support evidence based care, and overcoming these challenges requires teamwork, open communication, trust, and a commitment to placing the woman at the center of the medical care. Strategies to promote and support physiologic birth. The first strategy is it is evidence based and it is beneficial. Physiologic birth is considered to be optimal and evidence based approach to childbirth. So it promotes the outcome for both mother and the baby, and it supports the natural process of the body, and it reduces the unnecessary medical interventions and their associated risks. The second important strategy is that is education. Okay, while even the expectant parents understand how labor naturally works, they are more confident and less fearful. Okay, so it prepares the woman to make informed decisions during pregnancy and childbirth, and it reduces the fear and anxiety. The third strategy is awareness about benefits and risks. So the childbirth educator, they play an important role in sharing the information about benefits and risks. So all the associated potential risks should be explained to the mother, and informed awareness helps the woman actively participate in decision making, and knowledge enables the parents to choose practices and care that support normal birth. And role of a childbirth educator, so they act as an advocate, okay, for the childbirth. So this education classes can be provided through childbirth class, hospital and service program, professional conference and meetings, social media platforms. And the educators should teach evidence based and best practice information. So when they are teaching the parents and the mother, they have to teach about on evidence based information and best practice information to the families and women. The next strategy is importance of informed decision making. Okay, informed decision making should be central to childbirth education, and all the women and the parents and the families, they should receive a complete and unbiased information. So it is not about the preference of the childbirth educators, what she feels good, not like that. She has to give explain about explain, and she has to keep in front all the possible methods available, possible options available, and for each option she has to explain about the advantages and disadvantages, and the decision should be taken by the mother alone. Okay, the parent should be encouraged to evaluate options and make choices based on evidence, and shared decision making promotes autonomy and satisfaction with birth experience. Goals of prenatal education. So it increases the confidence for the woman, and it provides knowledge about normal labor, and it helps in coping measures. Okay, comforts and coping measures. It helps to anticipate, helps the woman what to anticipate during labor. Okay, and understand available resources and choices and active participation. Development of individualized birth plan, and women should be assisted in creating a personalized birth plan. Birth plan acts as a roadmap for labor and delivery. They help maintain normal birth practices whenever possible. Plans can guide decision making if complications arise. Birth plans improve communications between families and healthcare providers. And use of positive media resources. So, positive and accurate media sources can be used while giving childbirth education. Useful resources include educational TV programs, reliable websites, online educational materials, videos demonstrating normal birth practices. So, these resources can be used as a supplement in the classroom learning. Need for out of classroom learning. Additional materials are important when classroom time is limited. Referral to trustworthy sources and continuous learning strengthens the preparation for childbirth. Role of maternity care providers. They should understand the physiology. All the doctors, nurses, midwives, the partners, and the doulas, they should understand the physiology of the childbirth, and they should develop a skills that support and facilitate physiologic birth, and encourage non-pharmacological comfort measures, and create a supportive and respectful birth environment. Next strategy is the role of nurses in supporting physiologic birth. They should examine and reflect on personal beliefs about childbirth, and that can serve as an advocate for normal birth practices. Nurses should encourage attendance at childbirth education classes, and they promote continuous labor support and evidence-based care. Importance of doula support. So, nurses and healthcare providers should support the use of doulas, and they can provide emotional, continuous emotional, physical, and informational support. And doula support is associated with reduced interventions rate, increased maternal satisfaction, and improved birth outcomes. Evidence based policies and practice guidelines. Hospital policies should be regularly reviewed and updated. Procedures should reflect on current scientific evidence. So, if at all some practice is not going to help with the positive birth experience, that should be evaluated immediately, and useful and appropriate and evidence-based practice should be inculcated in that place instead of that previous one. And practice guidelines should be support normal physiologic birth whenever safe, and evidence-based policies create culture that respects and promotes natural childbirth. So when all these strategies work together, they create an environment where physiologic birth can occur safely and successfully. Conclusion. In conclusion, physiologic birth and demedicalization of birth encourages us to view the childbirth as a normal and powerful biological process rather than simply a medical event. The female body is naturally designed for labor and birth, and in many situations it functions best when supported rather than unnecessarily interrupted. Physiologic birth often offer offers benefits such as faster recovery, improved maternal confidence, enhanced bonding, and better newborn adaptation. Demedicalization promotes woman centered care, informed choice, and evidence based use of intervention. At the same time, it recognizes the that medical interventions or medical care remains essential whenever complications arise. As future healthcare professionals, our responsibility is to provide safe, respectful, and individualized care. By combining the scientific knowledge and compassionate support, we can help women to experience childbirth as a positive, empowering, and memorable life event. Ultimately, the goal is not simply a healthy baby, but also a healthy, confident, and satisfied mother. At the end of this session, I would like to ask you a question. So, I would like to conclude with a question. If you were to counseling a low risk pregnant woman, what step would you take to help her achieve a positive birth experience? Or if you were to come across a low risk pregnant woman, what all advices you will give for the mother to make her birth experience to be more positive and more physiologic? Okay, think about that. Thank you.